The first topic I decided to discuss in regards to this article is connections between my experiences. And one thing that really stuck out to me in this article was the prevalence of amputations with diabetic patients. He mentioned that there was just kind of a shock when he began checking his patients' feet and how a lot of them weren't even aware of sore or wounds on their own feet and legs due to their uncontrolled diabetes destroying their nerves. And this is personal to me because my boyfriend has been a type 1 diabetic since he was 10 years old. And since the beginning of this program, beginning in physiology, when we began to learn more about this topic, I began to ask him questions about his experience and encouraged him to routinely check his feet himself, just knowing of the risk to diabetic patients. The next topic I wanted to discuss from this article was observations of health disparities during my past healthcare experiences. And in the article, another thing that stuck out to me was just the lack of proficient medical care in rural areas, particularly for the African American community. During my undergrad years and years working as a tech in various PT offices, I worked in a fairly wealthy white community. And since then, I have moved back to my hometown, which is more rural. And even just as a patient, I've noticed a big difference, like just with my primary care doctors, just the difference in how busy the doctors seem in this area and how rushed they are, and just the difference in the quality of care. My boyfriend has also noticed that difference as he has had to find a new endocrinologist for his diabetes. And it's just very disheartening in some aspects in that article to hear and to experience. But I hope that, as us as future clinicians, we're learning more about this issue, we can all help to fix it in the future. The article that I included was called the transaction or called Health Disparities, Gaps in Access, Quality, and Affordability of Medical Care. And just some really important parts of this article is just how shocking it can be that in a country with such cutting edge technology and so many healthcare facilities, there's just such a large gap in the population of people who are still receiving inadequate or poor medical care. And just the state of health, how much it varies among different populations. For example, infant mortality of African American babies is nearly 2.5 times higher than white babies. And that just kind of leads into how bias and discrimination plays a huge role in the differences in medical care. And that was according to a report from the Institute of Medicine. And then another major contributor to the problem of health disparities is the cost of medical care and health insurance. And the consequences of being uninsured correlates to fewer preventative services, which is really important for us as future PTs because, we hope to catch these things sooner than we are. And that's just disheartening with the lack of insured people in our country. Now on to my clinical rotation is in Huntersville, North Carolina. And this is a fairly wealthy town in North Carolina. The household income is well above the national average at $113,000 and only a 4% poverty level. The population is about 71% white, and it's faring well above the national average for health outcomes. And, upon my reflection, due to the predominantly white population in this area, I just hope to be ultra aware of any issues on inequality of other races or cultures. I feel this environment may cause me to have a lack of exposure to a lot of the issues we've been discussing, but my approach to patient care will change in this environment because I would like to pay that close attention to be sure that the care of people of color is equal to that of the white patients that I will most likely predominantly be seeing.